And the federal government has released more guidelines that will prevent the spread of COVID-19 as more states fully reopen schools. The Nigeria Center for Disease Control stated that schools had been directed to conduct COVID-19 risk assessment every week. The NCDC also disclosed that local governments and states were directed to conduct monthly and quarterly COVID-19 risk assessment in schools respectively. And Senior Health Advisor, Lagos Health Summit, Yishau Azizat, joins us now for an expert view on this. Good to have you join us. So we know now that the Nigeria Center for Disease Control has directed that some sort of risk assessment should be carried out every week. But even as schools begin to resume in every part of the country, what sort of risk do you foresee?
Okay, thank you very much. First of all, I think that the idea of having schools to be open is something that is actually inevitable. Other countries around the world are already opening, and they are finding other ways to mitigate or reduce the spread of COVID-19. So for me, I think that part of the management or protocol rolled out by the federal government to reduce or mitigate the spread of COVID-19 is not deep enough. So say all schools are open, and we've discussed the public health tools to help to reduce the spread of COVID-19, which is physical distance, the use of face masks, and regular washing of hands. So for schools that do not have access to a water supply, these are some of the risks that I'm seeing. How do these kids wash their hands? For schools that, especially in large public schools, whereby we have nothing less than 3,000 students in primary or secondary schools, how are you able to ensure physical distancing? So these are some of the things that the federal government has not stated in their plans. And I think that one of the things that is most important is that when they are making this announcement, that the plans that they have are specific and the solutions that they are providing are in-depth. So before now, I believe that the federal government should have made arrangements with the joint tax team and other stakeholders to ensure that schools are making efforts to provide water. Schools that do not have water, a good water system, are already making efforts prior to now. Public schools that there are a large number of people, are they refurbishing? Are they
all right. So this is where the concern really is, because educators are also talking about shortage of water supply, shortage of non-teaching staff, as well as issues around fatigue among teachers because of the staggered reopening. But for low-income private schools and public schools, like you have mentioned, what can be done at this time?
Okay, so like I said, first of all, it is quite futile to say that all pupils in a school should come to school at the same time. When we're talking about trying to bring about physical distance and reduce the effect on staffs and non-teaching staff. So a situation whereby students come on alternate days, where the number of students, maybe a specific group of students from primary 1 to primary 3 comes from 8 o'clock to 12 p.m. and then the next set of students come from 12 p.m. to 4 p.m. This would allow spacing. This will reduce the number of staff that need to be in school at the same time. And so that's my suggestion. So I think that more effort should be made to reduce the number of students that come to school at a particular time, and then alternate days should be applied. Students to come on alternate days to school. It will reduce the number of pupils that come to class. It will allow for physical distancing. It will also reduce the number of staffs or teachers that need to be in school at the same time.
All right, Senior Health Advisor, Lagos Health Summit, Yishau Azizat, thanks for talking to us.